going to focus on is the Maitland Mobilization. And we'll go to why we're going to use it first to kind of understand what the purpose is to apply it to our patient. So the big whys are that it reduces pain irritability within that joint with a restricted motion. And that's typically within the grade 1 and 2 mobilizations. And it will also increase range of motion and reduce that restriction, and will decrease stiffness within a joint, which is seen in grades 3 and 4. So it's, in this particular one that we're focusing on, is Maitland mobilizations from a sustained standpoint. So starting off with grade 1 is small amplitude, and that's performed within the range of motion that is available. So it's fairly non-provocative and small amplitude, so it's not very aggressive or fast motion. Grade 2 Maitland is a large amplitude movement within the range of motion, so still working within the motion that we have, but now you're applying more force or moving it more quickly. Grade 3 is our large amplitude, and now we're getting into the point where we are reaching towards the restriction, where it'll be more provocative, and it's more than likely progressed in such a way that you're not starting off from most provocative and then working down. So now we're getting more provocative with this technique towards the end range of motion. And then grade 4 in the sustained being the highest level is small amplitude movement, but it's performed at the very end range of motion, so deep into the range of motion. So for grade 1 and 2, as mentioned before, these are mainly done to reduce pain and pain irritability within the joint that's being caused by the restriction. Grades 3 and 4, we're actually stretching the joint capsule that has now been reduced and restricted, and we're stretching the passive tissues which support and stabilize that joint as well. So kind of more from a arthrokinematic standpoint, we're trying to increase that or restore proper motion within the joint that has been reduced. So if we come all the way over here, this is our visual demonstration, or just a visual aid as far as understanding what that means. So starting off with grade 1, it's a very small movement, very well within the range of motion and far away from this end range that is being reduced by the injury. And then we move down to grade 2, larger amplitude movement, but still well within that range of motion. Come down here, the green, that's grade 3, and now we see our large amplitude movement, and it reaches all the way to the end range of motion, and it just sits sustained there. And then grade 4 down here moves past that barrier, not by much, but larger, small amplitude just past the barrier, and that's kind of really reaching that provocative range, trying to bring back motion into the joint and focus. So I'll have Joel come over here. Our patient that we would like to use this mobilization technique on is a 20-year-old football player. He's a male offensive lineman. He suffered a grade 2 ATF plus CF lateral ankle sprain while playing. The reason why we want to use this is that he's been immobilized in a cam walker, so now we have some restriction, not so much in that gross osteokinematic movement, but now we're focusing on that small arthrokinematic motion to try to bring back the proper dorsiflexion and plantar flexion, which he needs to get in a stance, get out of a stance, perform normal techniques at a high level. So with him, we'll use it progressively within the rehab, but the first one we're going to do is we're just going to start with a grade 2 and just kind of bring him up into within his own barrier, so not causing any pain to him. But we're going to try to promote that proper arthrokinematic motion as mentioned before. And as we talked about, this technique is sustained. So as we reach that point where we think we want to be, it's just going to hold there and go back to resting. Bring it back in there again, and then bring it back out. Now, if we were going to do a grade 4, maybe later in the rehab, and try to promote further gaining that range of motion back, we're performing that small amplitude movement right at the very end though. So now it's increasing gradually to that end point, going just past and bringing it out. Doing the same again, just past and bringing it out again, similar to how that demonstrates. And for us, that's our Maitland mobilization.